Hello, everyone. I'm Jody Tropiano-Green, the head of content for health, and we're here at the Beat Executive Series. And I have the pleasure to be joined by Dilpreet Sahota, the CEO and co-founder of Trek Health. Thanks for joining us.
Yeah, thanks for having me.
Conference been good so far?
Yes, it's been exciting, tons of energy. Appreciate you having me.
Awesome. Well, I want to learn a little bit more about Trek Health. So to kick it off, I know that you were really founded to turn promise into federal price transparency regulation and kind of turn it into a competitive advantage versus just a regulatory requirement. So can you tell me a bit about how you're doing that?
Yeah, absolutely. So at its core, back in 2022, CMS led to the eventual outcome, which was all health plans and all hospitals had to start publishing price transparency data. And although that data is available now, it's quite difficult to access. And so what we do here at Trek Health is we have all health plans and all hospital price transparency data aggregated and make it available for health plan CFOs and health system CFOs so that we can go in and negotiate strategically as we're jumping into payer negotiations. We often find that since healthcare pricing has been such a not clear realm of the industry, and there's been tons of variance in rates on the basis of really random nature of how these rates have jumped up and down. What we do is we help CFOs make sure that we're really targeting benchmark rates with great strategy and clarity before we jump into payer negotiations. Most often what that looks like is you'll have provider organizations that might be 10, 20, 30% below market average in terms of the rates that they're receiving today. And so we give them a clear, crisp view into what fair should look like, and we make sure that they're advocating for fair reimbursement during the negotiation.
Yeah. That's fascinating. And I know that there's probably a lot of friction and you're providing this, I guess, more seamless experience and more aggregated data for them to use, but there's still friction. And now enter AI. I'm sure that's playing a role to kind of streamline these negotiations. So can you tell me how you're leveraging AI?
Yeah, absolutely. So Trek Health's AI strategy is multifold. First is in aggregating and streamlining the data itself. We work with many AI tools to make sure that the noise gets sifted away from the truth and that we're able to aggregate really what matters within the price transparency data. Secondarily, we often find that the underlying payer contracts themselves are quite complicated. In the most extreme case, a single payer contract is 1,300 pages between the provider and the payer. There's tons of underlying complexity that is involved in reimbursement scenarios and reimbursement methodologies in terms of at-risk arrangements as well. And so what we do is we use large language models and AI to ensure that we extract all the important information from the rates, from the contracts, and bring it forward so that within 10, 15, 20 seconds, we can get the answers that otherwise would have taken analysts and lawyers 20, 30 hours to go out and extract from the payer contracts. At the end of the day, the payer contract is 95% of what the revenue engine will become for a provider organization. It determines all your fee schedules, what you can and can't do. And so we use AI to help bring truth to that.
Yeah. So make it easier, but also help with reducing costs because hundreds of billions of dollars are spent on administrative friction in healthcare. So what shifts, I guess, do you see in the market to reduce that friction and really make a dent at that cost?
Absolutely. So I see that the primary underlying trend that's going to likely become true over the next decade is that you have these high cost inpatient services historically that have only ever happened in the inpatient hospital setting that are moving into the outpatient context. And so you've got ambulatory surgery centers that are popping up across the country that are taking hospitals-based surgeries that otherwise would have cost $40,000, and they're doing them in the outpatient lower cost setting for $15,000. I think we're going to see this trend of hospital at home or hospital being broken apart with some of these services being put in the outpatient context. I think we're going to see that continue to proliferate. And ideally, although there will be winners who make a lot more money as a provider in terms of total reimbursement, total cost of care, I think, is going to actually come down because you're going to take these high cost inpatient services and transition them into these lower cost outpatient services. And so I think the winners will be those providers that actually lean in to identifying these high cost gaps, whether it's diabetes related treatment, dialysis, whether it's high cost surgeries, and finding low cost outpatient alternatives to do those.
Yeah. And we've been hearing a lot at this conference, the word trust. And trust, there's so many partnerships and you really have to have trust at the core of all of those partnerships for all of the companies that you work with. So how do you think about trust, validation, explainability of your AI outputs?
Absolutely. So first and foremost, I recommend for any health system or provider organization that's looking at evaluating price transparency vendors, you should actually ask a price transparency vendor to pull your rates from the price transparency data, and you should do a validation to test the accuracy of the data. And you should actually look at, to the level of dollar and cent, does this data contain what I truly am getting reimbursed today based on my existing contracts? You'd be surprised. Many are trying to enter the industry and trying to pull this data, but there's tons of underlying complexity. And I think the best thing that you can do to validate that a vendor is actually going to be able to support is by actually asking them to just pull data for yourself. And likely, if they're able to successfully pull data for your entity, they will be able to pull market data benchmarks as well. So that, first and foremost, I think is extremely important. Second is for all things related to AI outputs, whether it's deriving insights from payer contracts, whether it's deriving insights from clinical context, I think it's really important to trust but verify. Everything should be sourced, everything should be tested. We should know that any real-time AI use case that's deployed in the market can get sourced back to the underlying truth. And in the event of an eventual audit, we should be able to see why the AI was able to decipher the answer this way. And we should be able to test whether or not it was accurate. And I think it's important to consider as you're looking at experimental use cases as well for AI.
Yeah, we were giving great advice to any of the providers listening to this. So I'll ask you for some more advice for them as they're navigating the constant shifts in reimbursement policy on the payer side. Even this at this conference, we've heard of a few. So what advice would you have for the providers out there?
Totally. From a reimbursement perspective, I think it's first and foremost, it's normal and okay to find areas where you're actually going to expect for reimbursement to come down. I think there's been a ton of anxiety around recent shifts in Medicaid policy. There's been some angst that I've been hearing about from the market on declines in what we would have expected Medicare to give us from a reimbursement perspective. So first and foremost, I think to risk mitigate, providers should really understand what are those areas where likely reimbursement will come down, and we should have a strategy for that. As an example, for a hospital outpatient setting, likely we should expect that surgery reimbursement will come down. So let's get ahead of our ambulatory surgery center approach. Let's make sure that we're ready to shift some of those services into the outpatient setting. Next is build out a market perspective and understand the underlying truth. I think many health systems have had historic payer contracts that might go back 30, 40 years in terms of the relationship with the payer. In many cases, it's still that underlying original contract that is still to this day in effect. And what providers should do is do a real market benchmark. Just understand how are your reimbursement metrics versus your competitors. Identify a cohort of entities that are actually truly competitive to yourself, or maybe relatively sized and might have the same underlying specialties as well, and do a true market benchmark. Look at the underlying price transparency and see if there are these spikes or declines in reimbursement for yourself versus your competitors. That'll likely give you a pretty clear perspective on where there's opportunity for your underlying strategy. And also, finally, build out a plan-based approach. I think historically, many folks have betted greatly on the commercial line of business as the profit driver. I think in this new world, we're going to see a ton of pressure on ACA marketplace plans. We're going to see a ton of pressure on commercial plans. And so we should really have a robust approach about what you're going to do differently in your Medicare plans versus your Medicaid plans versus your commercial plans, and execute those appropriately. Don't treat it all as one big homogenous group of payers. Have a clear perspective on what you want to accomplish with Medicare Advantage versus Medicare Supplement versus ACA or as it's up.
That's great. Really good information. You know your stuff. Yeah.
Thank you.
So can you paint us a little bit of an ideal picture of the future when it comes to reimbursement and administrative workflows and how we'll get there to that future?
Yeah, so I think from a reimbursement perspective, if I was to lay out sort of the magic vision of the next couple decades, I think we're moving in the trajectory of having a true clearinghouse opportunity here. Historically, clearinghouses have been the arbitrator of truth after contracts have been negotiated. As price transparency proliferates, I think there's going to be a real opportunity for providers and payers to have a clear and crisp understanding of what the market clearing price should be, and decide whether or not they want to go in network based on that. And so that's, I think, the sort of vision of the future that I'm excited about. Everybody will have a clear perspective on what the rate is that they should be getting for any underlying service and whether or not that's fair. And they should decide proactively whether or not they're going to render that service. Finally, what I'm most excited about beyond that is that for patients, we're likely going to be looking at in the next couple of years a reality where before you walk into the clinic or before you walk into the hospital, you can actually predict within the margin of 5% what your true cost is going to be. Today, that's totally not doable. It's not happening at all. And you walk into the hospital thinking something, you walk out with a crazy surprise bill. I think the most impactful work that Trek plus others working in price transparency will actually have on the industry is that patients will be able to predict what costs they're actually going to have when they're going through any underlying service. And so there's interesting stuff happening for providers. Hopefully downstream, we're going to see that reality for patients soon too.
Well, thank you for tackling this problem, because I think a lot of patients would really appreciate that future that you painted for us.
Appreciate it.
Thanks for joining us today.
Thank you.